Good morning, good afternoon, and good evening to all of you, wherever you are joining us from around the world. Welcome to this Forward Thinkers webinar convened by the World Future Council. My name is Alexandra Wandel. I'm Executive Director of the World Future Council, and it's my pleasure to moderate the event on the topic, Our Planet, Our Health, Success Factors for a Toxic-Free Public Procurement. We're excited to offer you some insightful contributions on this topic in the webinar, which we're organizing on the occasion of today's World Health Day. And the topic of today's World Health Day is actually Our Planet and Our Health. It highlights the interlinkages between human health and the environment. Never before did our decisions and actions have such profound consequences. And this is also why the World Future Council was founded back in the year 2007 in order to identify and also spread effectively policy solutions for current challenges humanity is facing. We honor them and we also make them known with our Future Policy Award. The Future Policy Award is globally the only award that celebrates policies that create better living conditions for current and future generations at an international level, and we celebrate the award in partnership with UN organizations and other partners. The awarded policies provide an excellent starting point for a race to the top to secure a safer world for our children and future generations. Every 2 years, we identify a topic that is of particular urgency. While the topic climate and biodiversity loss are very well known, the topic of climate pollution is not yet so recognized, although it is a very urgent topic. Far too little is known about chemical pollution, its devastating impact, and also the solutions that are available to tackle that crisis. For this reason, our council has decided to honor exemplary policies with our Future Policy Award on protection from hazardous chemicals, which we organized together with our partners UNEP, SciChem, UNEP, UNITAR, ILO, and OECD, with the support of the Federal Ministry of the Environment of Germany, the Federal Environment Agency, and the Michael Otto Foundation. Today, we want to discuss particularly also one of our award-winning policy. It is a policy from the Swedish region Stockholm that prevents the procurement of chemical products containing toxic substances. Amongst them are many of the top 10 chemicals of major health concern. Exposure to such substances create a significant health risk, especially to children. And since 2012, the region Stockholm has phased out a significant proportion of hazardous chemicals. In particular, they have achieved a 90% reduction from the healthcare sector. The policy results are very impressive and also worth to replicate them. Let me now share a couple of figures that show the significant role public procurement plays. Public procurement has an enormous purchasing power. In developing countries, up to 30% of GDP is in public procurement in many developing countries. In OECD countries, the figure is about 12% of gross domestic product. Therefore, promoting sustainable practices in public procurement is really key to achieve a toxic-free tomorrow. Today, therefore, we will be dedicating our initiative to exemplary policies and examples from around the world that are advancing a healthy, toxic-free future. We want to look specifically into the success factors that make such initiatives effective. Let me now give a quick round of how the program will evolve during the webinar. First of all, we are very delighted to have with us Dr. Monica McDevitt, the Chief of the Chemicals and Health Branch of the United Nations Environment Programme, UNEP. She was also part of the Future Policy Award jury, and she will, in her introductory remarks, outline the nexus of chemical pollution and poor health, talk about the devastating impacts of hazardous chemicals also on children's health, and set the stage for our discussion today. We will then see a brief video from our partner UNDP on chemicals. Afterwards, we look into our details of our award winner from Region Stockholm that have achieved 2 commendable phase-out lists for chemicals hazardous to the environment and human health. And we will listen to a presentation of Mrs. Marlene Fidjian-Paksai, who is the chairperson of the Climate and Sustainability Committee from Region Stockholm in Sweden. We will then afterwards move to our discussion. And there we are delighted to have with us, besides Mrs. Magdevet and Mrs. Fidjian-Paksai, also Dr. Rosemarie Komwenda, who is the coordinator of the Sustainable Procurement in the Health Sector Project from UNDP Istanbul Regional Hub. Also Dr. Megha Rati, who is the coordinator of the Sustainable Health and Procurement Project from Healthcare Without Harm. Jenny Roviu, Sustainable Innovative Procurement Expert from Finland. And Pablo Ricardo Rodriguez Rubio, who is the National POP4 and Mercury Project Coordinator from UNDP and from the Ministry of the Environment of Honduras. Thank you all distinguished speakers for accepting our invitation and making time to share your expertise with us today. Please note that this webinar is live streamed on Facebook. And please also join our conversation on Zoom and Facebook. We really would like to know your thoughts and your questions in the chat function. I'm now delighted to welcome Dr. Monica Devet, Chief of the Chemicals and Health Branch from UNEP. Mrs. McDevet, the floor is yours.
Thank you very much, Alexandra. And let me see if I can get this technology working. Just need to make sure that you can share my screen. If somebody can give me a heads up that my screen is being shared. Alexandra?
Yes.
Is it all right? Can you see my?
Yes, it's all right.
Okay, fantastic. So thank you again for the invitation to help set the scene today for today's webinar, focusing, as you said, on the success factors of a toxic-free public procurement. Pollution, as we all know, affects our air, our land, water, people's health, and the ability to enjoy the most basic human rights. In fact, the right to a clean, healthy, and sustainable environment has been declared a human right by the Human Rights Council. Pollution also inhibits economies and in many ways impairs the achievement of the SDGs. Chemicals widely used in consumer goods can pose serious health risks. For instance, they can interfere with human hormone systems, cause cancer, or affect development and reproduction. And as has been reported for bisphenol BPA in baby plastic bottles, for example. Around 1 in 3 children have lead in their blood at levels that may be associated with decreased intelligence, behavioral difficulties, and learning problems. Many sources lead to this contamination, including the unsafe recycling of waste lead-acid batteries in poor communities. COVID-19 pandemic and the environment have multiple linkages. Over the past 2 years, we've experienced a spike in hazardous waste, such as personal protective equipment, electronics and pharmaceuticals, as well as single-use plastics, much of it resulting from the urgency to procure personal protective equipment from public resources. Recently, the UN Environment Assembly took historic resolutions on pollution with major repercussions for health toward creating a legally binding instrument on plastic and on the establishment of a science policy panel on chemicals, waste, and pollution prevention on par with the IPCC for climate change and IPBES for biodiversity and ecosystem services. These will help us in the critical nexus between science and policy and provide greater insights into understanding the nexus between chemicals, waste, and pollution, and best practices to minimize harmful effects on the environment and on human health. Policies for public procurement can benefit from these efforts. So let me just give you a couple of examples here in terms of setting the scene. As we know, chemicals are important components in almost all manufactured products that make up our modern society, and we rely on for our daily life and the way we appreciate life. Some of these chemicals are harmful and can be released at any stage in the resulting life cycle of that product and cause potential exposures to humans and accumulate in the environment. For example, as I've said before, bisphenol A is an industrial chemical that has been used to make certain plastics and resins since the 1950s. BPA is found in polycarbonate plastics and epoxy resins. Polycarbonate plastics are often used in containers that store food and beverages, such as water bottles. And BPA, as I've said before, is a known endocrine disruptor. PFAS, or per and polyfluoroalkyl substances, are widely used, long-lasting chemicals, and components of which break down very slowly over time. There are thousands of PFAS chemicals, and they're found in many different consumer, commercial, and industrial products. This makes it challenging to study and assess potential human health and environmental risks. Lots of other examples include releases of solvents from the manufacture of paint, releases of plasticizers from toys during use or when your children play with them and chew on them, releases of BPA from food containers, and the releases of PFAS from waterproof chemicals such as outdoor textiles during when you wear your clothing, and also the releases of flame retardants from various products formed during the recycling operations at the end of their life cycle. In addition to just the chemicals themselves, harmful chemicals in products can be a barrier to recycling, as they can contaminate the products that are made from those very recycled materials. So better management and phase out of chemicals of concern in products is an important step to curb chemical pollution and to advance on the sustainable consumption and production, including circular economy approaches. Sustainable public procurement can contribute to this important goal. So within the public sector organizations, we have had a marked impact on sustainability by setting out a proactive life cycle approach to managing chemicals of concern within sustainability and sustainable procurement policies, for example, through a clean chemicals management plan. Sustainable public procurement, I just want to make sure that we're all on the same slide here. Have we gotten out of sync with ourselves here? There we go. This is the one I need to be on. Sorry, Alexandra.
No problem.
Yeah, sustainable public procurement policies can play an important influencing role by creating a demand for safer and non-toxic products, thereby creating and increasing markets for these products. Thoughtful sustainable procurement practices can contribute and support the transmission of information on chemicals in products along the entire value chain by emphasizing how producers at each stage in the manufacturing process generate information on chemicals used in producing the end product, and how this is made available across the whole value chain from producers to procurers and users and into the disposal. By growing markets for safer products and increasing transparency on chemicals within the value chain, sustainable public procurement policies can complement regulatory efforts. Okay, there seems to be there we go. All right, so what are some of the examples of approaches that can be taken? I think first of all, we need to make sure that anything that we do needs to align with the practices that we take on chemicals of concern by applying a life cycle approach. What we have done in terms of UNEP's recommendations is come up with a set of tools that you can use and also recommendations to consider. And I've listed them out here on the slide. And so I'm not going to read through all of them, but you can see that there are quite a few, and there are even more in the report. And the link will be put into the chat box and made available to everyone. But there are lots of things that can be done. And I think that's what the main message is here. Okay, what have we been working on? Just to give you a few examples of, well, what is UNEP doing, being the environment program of the United Nations. One example is that we've been developing, as I've said, guidance documents for sustainable public procurement, specifically for electronics. The goal of this work was to provide guidance on how public procurers could integrate the issue of chemicals management into their organizational sustainability and procurement policies. This looks at 3 levels. One is compliance, and therefore reducing instances of non-compliance, good practice, going beyond regulatory compliance, and also going beyond good practice, moving toward a more strategic approach. A pilot application of these policy guidances on electronics is currently underway in Colombia. We're also looking at developing these global guidance documents for procurement in building products. So in 2018, UNEP published its report on building circularity into economies through sustainable procurement. The report introduces the role that sustainable procurement can play to accelerate the transition toward a circular economy and make the shift toward more sustainable patterns of consumption and production. Okay, Alexandra, I think I'm going to stop there, and I hope this has given everyone a little sense of what is to come in the rest of today's webinar. And I really do look forward to enjoying the panel discussion and the question and answer session. So thank you very much.
Thank you very much, Monica, for setting the stage so excellently and also for your very important work. So we will watch actually a video about chemicals from our partner UNDP, and it has been also produced with the support of the German Ministry of the Environment and Nature Conservation, Nuclear Safety and Consumer Protection. So thanks to both of them that we can show the video.
Chemicals. Let's have a look at them from the right perspective. Chemicals are the building blocks of everything we know. Through research and experience, we discovered and synthesized a lot of powerful chemicals that allowed us to achieve any kind of goal. Pest control, energy storage and transmission, gold extraction. Mercury, for example, is added to mineral compounds in which it binds with gold particles. By simply burning it, mercury evaporates, leaving us with pure gold. Great! However, vaporized mercury is highly toxic and tends to accumulate in animal tissues and therefore in food. According to WHO, improper use of chemicals caused about 1.6 million deaths in 2016. A lot has been done to regulate production, use and disposal of some hazardous chemicals, but it's still not enough. Of the estimated 100,000 existing man-made chemicals, only 500 have been studied sufficiently to know their risks, while we have partial or limited information on only 30,000. We need a different and more integrated approach to be able to eliminate harmful chemicals and thus enable a truly circular economy. UNDP, along with all other SciChim stakeholders, are developing a framework for managing chemicals and their risks. It is time for people, communities and organizations to join the conversation and commit to change. Are you with us?
So as Monica and the video highlighted very clearly, we definitely need to change course and step up action on the proper management of hazardous chemicals in order to eliminate those that are really highly hazardous. And public procurement can really play a critical role. Now we want to visit the Swedish region of Stockholm that has successfully introduced 2 phase-out lists for chemicals hazardous to the environment and human health. They were awarded with the Future Policy Gold Award by listing approximately 108 individual and group of substances to be phased out, and by making this list mandatory for all chemicals product procured. Region Stockholm has opted for a focus approach to abandon their use in the near future. Let us now welcome and listen to the presentation of Mrs. Marlene Fijen-Pacheri, Chairperson of the Climate and Sustainability Committee from Region Stockholm. She will give us some better insights into this exciting policy. Welcome.
Thank you so much for having me. I will try to share my screen. That's the wrong. Just one moment, please. Don't know why this is not working. Well, I do have a problem with changing slides, so let me try again. Try this. Well, here we are. Thank you so much. No. It's disappearing, right? will you take over or will I try again?
Damien, will you take over?
I have already.
So I will start again. I'm Malin Fein-Poitrai. I'm a politician in the region Stockholm, and I'm a chair of the Climate and Sustainability Committee. We can take the next slide, please. Let me just introduce Region Stockholm in a very short matter, so that you know what we are handling with. Region Stockholm is a county-level political organization in Sweden, and it's regarding the county of Stockholm, obviously. We are responsible for all healthcare, public transport, culture, some culture, and spatial planning within the Stockholm County geographical area. And we have 45,000 employees doing all these things. The budget is around 10 billion euros per annum. We can take the next slide. Well, what was the background for us starting with the work of the phase-out lists? Well, those 10 years ago, we identified that we were using substantial amounts of hazardous chemicals, and we felt that we have a responsibility to protect people and environment, of course, also because of the area that we are dealing in, which is the health care area. So we said our operations should not harm environment or make people ill. And we have had a very strategic work doing this and developing the phase-out list to address the problem. Next, please. So the first step is, of course, how to make up a phase-out lists. First things, of course, is to decide what chemicals, hazardous chemicals, to avoid. And after we were doing that, we were making an inventory of chemicals used in the region Stockholm's healthcare sectors, and also in the operation and maintenance of our properties and the public transport services. After that, we were sorting all identified chemicals, and we're prioritizing according to the hazard. We have two different levels, you could say. Some are just banned and some are just for the phasing out list. And after that, we were issuing two phase out lists for hazardous substances, one for chemical products and the other list is for chemicals used in different goods. And the goal is to phase out these substances step by step through the procurement system specifically. And the last step is implementation with our employees in the operation. So this is the background for developing the phase out lists. Next, please. So what do we do in practice? Well, in purchasing, when we are in procurement, all the relevant substances applicable to the scope of the procurement are taken from the list and applied to the requirements. And all the companies that want to take part of the procurement, they have to take this into account. After we have a deal, we will also, and are using we have purchased the products or the goods, then we systematically follow up on the chemical criteria in procurement. And that could be either on basis of samples or on basis of written documentation. And if a company is not keeping to the criteria, they will either be having to pay a fee, or they could even be an agreement ended by this. The lists are also applied to Region Stockholm's all departments and organizations' daily work. So that means that the organization is working with this lists daily. And that makes it easier for the employees to make informed decisions when they are choosing a product. They can easily see what kind of product is on the list and choose, if possible, another product. Next, please. So what has the impact been the last 10 years? Well, in the healthcare sector, we have seen a 90% decrease in the use of listed substances. We have decreased the use from approximately 1,100 kilos of chemicals to something like 115 kilos of chemicals, which is quite a substantial decrease, of course. We have also seen that phthalates have been phased out from many of the products procured, for example, from medical devices. And allergy-inducing perfumes and preservatives have also been phased out, more or less, from chemical products. We have seen a big decrease in the use of disinfectant glutarol, which can cause allergy and is toxic to aquatic life. Next, please. And what are these success factors and what have we learned? Well, maybe we will talk some more about that during the panel, but let me say first that we have seen that measuring the use itself is a first step to start phasing out. We found use of chemicals that we did not know of. For example, in public transport, we have seen we did not have very good idea of what chemicals we were using, and we now have a much better understanding of what to use, of what we should use, but also what we are using at this point. Of course, by using this phase-out lists and applying them to the whole organization and all relevant procurement, purchasing, we have made it a holistic perspective on phasing out hazardous chemicals. We have also used a broad implementation in the organization, and we have been working together with the employees, and that have made, I think, the great success, to be honest. The phase-out lists, they're also public, and they can serve as inspirations for regions and countries in Sweden and elsewhere, though I think they're only available in Swedish, so you will have to work a little bit on your Swedish. Next one, please. And that was just to say thank you so much. And if you want to stay in touch, just write me an email, please.
Well, thank you so much, Marlene, for this comprehensive overview. And again, congratulations to you and Region Stockholm. And in this category, 2 gold awards were given, and you received a gold award for your excellent phase-out list. So it's excellent that you have been able to share with us. Let us now start with the panel debate addressing the role of public procurement in inspiring change towards a tomorrow without toxics. And we want to discuss recommendable initiatives from across the world and highlight success factors that make such initiatives particularly impactful. And during the debate, you will also be invited to ask questions and make comments in the Zoom question and answer section. And I will then direct them to the speakers versus the end of the debate. I would now like to welcome Dr. Rosemary Kumwenda, who is the coordinator of the Sustainable Procurement and the Health Sector Project. She's joining from UNDP Istanbul Regional Hub. Welcome. We also have with us Dr. Megha Rati, who is the coordinator of the Sustainable and Health in Procurement Project from Healthcare Without Harm. Also, Jenny Roviu, Sustainable and Innovative Procurement Expert from Finland, and Pablo Ricardo Rodriguez, who is the National POP4 and Mercury Project Coordinator from the UNDP, but also from the Ministry of Environment from Honduras. So in addition to Dr. Magda Wett from UNEP and Mrs. Fichim Pakshe from Region Stockholm. So thank you all for joining us for this timely debate, and please be reminded that we need your answer to be concise with a maximum of 2 minutes. So let us now have a look into the role of public procurement to protect our health and our environment from hazardous chemicals. Dr. Kumwenda, welcome to you. You're leading the Sustainable Health and Procurement Project, which launched a Sustainable Procurement Index for Health, as well as the Chemicals of Concern for the Health Sector report. Which role can and should public procurement play in protecting us from hazardous chemicals? And how has the project helped advance the sustainable procurement in the health sector?
Thank you, Alexandra, for the question, and thank you for inviting us to share our lessons from the Sustainable Procurement in the Health Sector project, which is funded by SIDA since 2018. And the project actually focuses on health procurement because the health sector is a very important one and has a moral obligation to heal people. But while we do this, sometimes it contributes, not sometimes, it actually contributes up to 4 to 5% of global greenhouse gas emissions, and supply chain contributes 70% of these emissions. So the health sector needs to lead by example. So clearly the 10 project countries are part of the pioneers of our work to provide sustainable procurement examples and impact stories as they did in 2021. Secondly, the project has sustained what we have as an informal United Nations interagency task team on sustainable procurement in the health sector. Why is this important? It's important for ourselves as the UN because we support countries to procure commodities, especially working in collaboration with the Global Fund and other UN agencies. So our own procurement officials need to understand sustainability, both environmental and social dimensions. So we come together with a purchasing power of between $4 to $5 billion annually. And so producing guidance and providing capacity building, including in choosing safer products for reducing hazardous chemicals, the use and adaptation of safer practices in all areas of health is very important for the project. Thirdly, SHIP has enabled the establishment of a healthcare interest group through the One Planet initiative. And I think you'll all agree with me that COVID has taught us a lesson that health should never be left behind. And therefore, within the health interest group, working alongside with other sectoral programs, such as construction, food and tourism, we are giving credit, first of all, to Sweden for your chemical substitution program in the healthcare. For us, the project actually made reference to that chemicals of concern list, and we have developed the project Sustainable Procurement in the Health Sector project has also developed chemicals of concern guidance. So we believe that going forward, even with the One Planet initiative, health should not be left behind, even as we are now looking at extending the project beyond 2022 into 2030 to align it with SDGs. So our procurement officers stand ready to exercise their social, economic influence in purchasing safer products. Over.
Thank you so much, Rosemarie. Let us now move on to Finland, and let me welcome Jenny Rovio. And you work on an exciting Finnish Green Deal for reducing hazardous substances, specifically in kindergartens and preschool environment. Very important for the children and all of their parents. So from your experience, is public procurement a game changer when it comes to the elimination of hazardous chemicals?
I think it's very important to raise awareness of harmful chemicals at all levels of society. And municipalities have a chance and possibility to influence the markets. And firstly, municipalities should identify the need to reduce these harmful substances in their strategies. And secondly, the targets should be integrated in the public procurement practices. So procurement is one tool to achieve these goals and strategies goals. And one step for the municipalities may be that it commits to the Green Deal for reducing harmful substances in kindergartens and preschool environments. But all of this, of course, is supported by the fact that EU has the most advanced legislation, and the EU REACH candidate list is something you can follow. And based on this, it is easy to plan future actions that goes beyond the law, like Swedish phase-out list for hazardous chemicals. Thank you.
Thank you so much. And let us now move from Finland further on to Honduras, and let me welcome now Mr. Rodriguez, and joining us from Honduras. Welcome. So from your experience at UNDP, but also the Ministry of Environment in Honduras, which role plays public procurement in reducing hazardous chemicals, and which role should it play?
Thank you, Alexandra, and thank you for inviting me as a representative of Honduras in this important webinar. I'm honored to be the only man among the women that are panelists in this webinar. And coming back to the question, well, public procurement play an important role since they represent a platform to remove from the official catalog the options of products and articles that contain hazardous chemicals. As they are not available on the market or being offered for purchase or in the tendering process, environmental and health problems related to their post-consumption management are avoided. These options that were previously available for large-scale purchases or tendering processes are now reduced or eliminated for safer alternatives and obey phase-down or phase-out criteria dictated by international conventions and national priorities associated with hazardous chemicals substances. This is like our experience from Honduras, working jointly UNDP and the Ministry of Environment, as well with the Ministry of Health of Honduras. Thank you.
Thank you, Mr. Rodriguez. Let us now have a look into the role of best practices in public procurement. We all have heard about the Gold Award winner from Region Stockholm. So let me ask again, Mrs. Fichen-Paksai, what evidence you know of, how are the phase-out lists that you have developed, how are they, have they inspired other regions in Sweden, and are you also supporting other regions to develop similar lists?
Well, we are working closely, especially with other regions in Sweden, but we also work with the Nordic countries on a collaboration. It's a kind of a phase-out list for all Nordics as well. When it comes to who we have inspired, I would love to know actually, because possibly we have inspired more than that we know of, but we know we are working closely with other regions also in purchasing, and we work also in the Nordics, and of course the EU we are following closely as well.
Thank you. So let me ask again a question to Dr. Magda Wett, because she's one of the main experts on the topic of global status of chemical policies, and you just had your second assembly of the United Nations Environment Assembly, and also there were stakeholders convening for the second process. So let me ask you, is the situation on chemical pollution, is it actually improving? And which role do best practices play?
Thank you very much for that question, and I think it's an important question, and Yes, we did have to resume the fifth session of the Environment Assembly in 2 parts because of COVID and virtual attendance. So we did just have that completion there. And unfortunately, we've known for some time now that the goal that was set for 2020 has not been met in terms of the sound management of chemicals and waste. But we do see the Environment Assembly, the 5th session, as a promising advancement on pollution. As I mentioned before, the plastics resolution and the science policy panel. So I think the world is taking notice and saying we have to do more, we have to up our level of ambition. So those were landmark decisions that the member states, and just to remind people, the member states are represented by the ministers or their equivalent ministers of environment in all of the UN country states. The sustainable public procurement aspect of this has a huge role to play, because policymakers can lead by example, as we've heard from the Sweden case. Ways that we can do that is through mainstreaming chemicals into sustainable public procurement policies. And we've already heard how impactful this can be. And also when you stop and look at the purchasing power of public procurement, ranging anywhere from 12% of GDP in OECD countries to 30 or more % in developing countries. So there's a massive opportunity through the demand side and the amount of money that is invested in procurement. So it's a game changer in terms of how we can actually look at policies to leverage sustainability. So there are some innovative ways that we can look at that, and procurement also drives innovation. So it tells the markets, the suppliers, that we don't want these old products anymore. We want to look at more sustainable alternatives, and we're prepared to pay for them, but you've got to give us what we need and take away the harmful chemicals. The other thing that I think is important to mention, just in sort of the global scheme of things, is that, as we all know, because of COVID, a lot has been sort of on the slowdown or having to be put off in terms of the ability to hold face-to-face discussions. And just to let people know, the intersessional process, the 4th intersessional process of the SciChem process, IP4 as we call it, and ICCM 5, which is long awaited, these are being rescheduled and they're coming up very soon. And these are crucial points where negotiations can take place. So stakeholders and governments and everyone who negotiates around the table need to look at those opportunities for entry points and innovations, including on the management of chemicals through public procurement.
Thank you so much, Monica, for this update. And it's, of course, very good to hear that despite the pandemic, there have been achievements made at the last United Nations Environment Assembly, and there have been even landmark agreements like the new plastic agreement that now shall be developed. That is very good news for us. And let's keep up working on also making procurement more sustainable. And let us now hear from Dr. Rati. I would like to ask about your Sustainable Health and Procurement project that you're organizing. And so it's playing a significant role in transforming public procurement in the health sector. You recently published a UN Sustainable Procurement Index for Health. Can you give us an example of a success story that has advanced sustainable procurement to ban hazardous chemicals, similar to like the award-winning Swedish policy?
Yeah, thanks for having me here, and congratulations to the Swedish policy. So we've been actually, as Rosemary said, so the Swedish policy has been used extensively within our project. We developed this list of chemicals of concern for the health sector. So when we started our project, the procurement officers had no resources or tools, to identify the chemicals of concern. And we compiled a list based on different authoritative lists in which the Swedish policy was an important contributor to. And as we moved on, one of the chemicals that we have been successful in phasing off is mercury, which has been listed across all the chemicals, the authoritative list. And I would just name a couple of countries where we have been able to do that: Zambia, Vietnam, Tanzania, South Africa, India, a couple of countries that we have been working with through the project. And it is illustrates that, that now there's a lot of demand for alternatives coming up, which was not the case earlier, So somehow the mercury ones was supposed to be gold standard, but now that's been shifted to, and there's a lot of demand that's there for the non-mercury ones. And just to say that, the health sector has been really instrumental in getting the Minamata Convention, because the health sector was one of the important sectors to work with Healthcare Without Harm, UNDP and WHO work jointly to get this on board. And as a result, we've had, a successful global environment facility projects in Afro region and global, where we've eliminated mercury. So I think that's been a very big success, and I could, contribute it to the collective work of all of us here. So,
Thank you so much, Dr. Rath. It's inspiring to hear about your work and that there have already been successes made. And now let us hear again from Finland, from Jenny Rovio. You're cooperating with your Green Deal with the Turku University of Applied Sciences. And they have worked since quite some time towards chemical sensible procurement in the Baltic region. And so in your role, which role play success stories from neighboring countries in your work in Finland?
Thank you, Alexandra. Yes, we have worked with Turku Applied Sciences for some time already. And in Finland, we have been very inspired actually by what Sweden has been doing. And we have gained a competence center for sustainable and innovative public procurement. And that's the heart in Finland's operations. Gaino is a network-based competence center that was founded 2018, and it is formed by national research institutes, national joint procurement organization, and other organizations that support municipalities and regions in promoting sustainable development. So our version of a Swedish model in Green Deal is developed from the Swedish Toxic-free preschool model, actually. And we thought that it would be great to have something similar in Finland. The idea of Green Deal commitment was developed then and had actually interest at the ministry level too. So also change the linear economy to circularity underlines the importance to eliminate hazardous substances from materials. Through this Green Deal, we can actually give concrete support to municipalities, and municipality procurers can take actions to reduce harmful substances in products and services they buy, and thus help municipalities achieve their goals in implementing their environmental programs. Thank you.
Thank you. So let us again hear from Dr. Rodriguez from Honduras. You work on removing mercury containing product items from the UNK catalog. I hope I pronounced it correctly. That is an online automated procurement platform. And which inspiration from best practices you have taken up? Which role did best practices play in the development of this online platform?
Okay. Well, in Honduras, this automated platform is named ONCAE. From our experience in Honduras, we started by developing pilot projects or activities in healthcare facilities, specifically in the 4 largest hospitals in Honduras, with the phase out of mercury added products, specifically medical devices such as thermometers, sphygmomanometers, laboratory reagents, dental amalgams, among other products and goods. By demonstrating the elimination of mercury in the purchase system or in these largest hospitals, the opportunity to scale the experience to a national level was created. That's why we seek to transfer this experience to the ONCAE platform based on these experiences. The next step was to remove the mercury added products option from the national catalog of the national purchasing platform. This was our experience with the ONCAE platform system here in Honduras.
Excellent, thank you so much. It is so exciting to hear about all the positive examples from around the world and how we can learn from each other. So let us have a look more closely into inspiring examples from other regions and cities. So let me ask again now our representatives from Stockholm, how will the region Stockholm now take its engagement of eliminating hazardous chemicals from procurement to the next level, to the higher level?
Well, it's interesting that you asked me. I hope you can hear me because I heard my microphone is not working correctly. But this is the best I can do, I'm afraid. The next step is that we will update the phase-out lists. They have been updated every 5th year. And now we will do this again this year. And of course, they are getting sharper every time. The list consists about 105, 110 different areas and items or chemicals. And this is the next step of doing that. The next one is that we have seen, as I told you, that in transport, in public transport, we are still using quite a substantial amount of chemicals also on the list already. And that means that we will start working more intensively with this area. Except for that, we have also a focus on exposure for children. And that means that we will have an extra focus the next few years in how to lessen the exposure for children in all kind of hazardous chemicals. These are some examples.
Thank you so much. We will closely follow your activities. We're really interested that you also now focus specifically on children. That is so important to us and for future generations. So that's excellent to know. So let me also ask now Monica again from UNEP, because you have a really good global overview. In addition to the example that we have from Stockholm now, are you aware of other inspiring regions or cities that have already advanced the phase out of hazardous chemicals with public procurement? And what are some of the challenges that countries face or regions face to ban hazardous chemicals in public procurement? And do you address this issue as well at UNEP?
Thanks for that question. I think as I mentioned in one of my slides, and apologies that they got a little bit mixed up thanks to the technology, but we have been working in Colombia, for example, through this pilot project on electronics. And so, you know, going back to those 3 principles of looking at compliance and good practice and going beyond good practice, we have been able to draw some lessons learned that we're developing from working at the country level. And what is absolutely paramount, and I think is well demonstrated in the award-winning policies from Sweden, is that you actually need to have a very strong willingness from the policy side. And without that political will and that policy willingness to push things through, then we find that we don't get that much success. Further, what has also been very good and very helpful is eco-labeling and looking at how to make eco-labeling something very accessible to the public so that they can make good choices based on sound reasons, science, and examples. And this has also been found to be quite a game changer. The other thing is that you're looking at a huge array or multiplicity of chemicals, and this can be very complex. So the need to transform or to translate the information from a very technical side, a very complex side, into information that a non-technical or non-chemical audience can really understand has been very challenging. And that's why we've adopted something that might sound so simple as, you know, comply, good practice, and going beyond good practice, and how we can make that a bit more accessible to people to make good decisions. We're also very much involved from the public procurement side in terms of how we can look at networks and share and mainstream some of these good practices from the whole value chain and the life cycle approach, so that we really understand every step along the way and not just the end product at the end of the day. So how do you tie it into the bigger picture? And I think also the sort of general public policymakers and procurers need to be aware that there are certain amounts of information on chemicals that is really important to transmit along the supply chain. And a lot of that information sort of sits within various actors along the supply chain. So encouraging them to really come forward and to work on some of the old principles that were, you know, brought to the fore many years ago. In fact, the Dubai Declaration that started off the entire SICAM process was to share the information and to know that those chemicals that pose a risk to the environment and to society, that there is a right to know what these are. So unlocking that information going beyond the information to the general public, but unlocking it from the supply chain and producers and procurers is very important as well. So those are just some of the lessons learned that can be shared to anyone who wants to work in this space.
Thank you so much, Monica. Let us now hear again from Mega Ranti. You also work at the global level, and I'd like to know from you which other inspiring examples are you aware of? Are there other cities or regions or organizations that really have advanced in the phase out of hazardous chemicals through public procurement? And are there still major hurdles that remain?
Yeah, no, thanks for the question. I think I have similar learnings, as Monica said, in the work we do. So specifically because when we started the public, the SHIP project, we work very closely with the procurement officers. And this was the very first time they were hearing about sustainable procurement. And it was just, they never thought that procurement could be sustainable. And this is an example from one of the countries. I typically take an example from India, wherein there was, they have a biomedical waste regulation which says to phase out PVC, but that regulation was really not used by anybody, not understanding how to do that. So we basically worked with the procurement officers in identifying the low-hanging fruits, like the PVC gloves was one of the most, low-hanging fruits there, and then work very closely with the Ministry of Health and in terms of getting nitrile gloves on board. So the entire procurement in India is done by an e-platform, which is called a GEM portal. And that's the very first time that the nitrile gloves were introduced. And I think so we can take the success there that working with some of the health systems, the Ministry of Health, hospitals and centers, we were able to eliminate PVC gloves, and now it's only nitrile gloves that have been procured in most of the places there. So I think that was one of the big successes that we had working with the procurement officers and e-procurement portals in countries like India, and then similar examples from other countries that are coming up. Like South Africa, we had a work around integrated pest management, how the pesticides were eliminated from the ground level from working with one hospital, and then getting policies at the free state level. And now all the hospitals are looking at the IPM instead of pesticides for in the hospital. So I think we have a couple of successes from across the regions, and that's growing further.
So thank you so much for sharing your success stories. It's encouraging that you already have some successes.
I don't know if the catalyst, I think that there was the second part of the question, the catalyst. For me, I think it's just, we
want
need
to still talk about the catalyst of the global phase out list? That would be great.
Yeah, so I think the catalyst for us has been, to mobilize and create the demand which was not there. And very often, the procurement officers are not aware of, what are the toxicities that are linked to the chemicals that they've been prescribing. So we've done a lot of work in terms of creating the demand, creating the awareness around this, and also working with them to develop policies, So I think these three have been important catalytic factors for us to move on. So.
Great, thank you so much. So then let me ask, I still have a question to Jenny Rovio from Finland. If you could explain to us also a little bit with your work on the Green Deal, what kind of challenges there are in limiting hazardous chemicals in public procurement, what kind of hurdles need to be overcome?
Okay, thank you. Thank you for the questions. Yeah, we have, because the model is quite new in Finland, we have noticed that there are some difficulties. For like often the contracting entities and procurement units have no previous experience or procedures particularly related to harmful substances. This subject is quite unknown in generally. We have also noticed that companies in the market area are in different stages, how well they know the harmful substances they have in their products. So regarding the supply chains of some product groups, more information is still needed about hazardous substances. And think that's the main difficulties we have noticed that we have to overcome with this subject.
Yeah, thank you so much. That is also important, that it's really important to continue raise awareness on this important topic and also continue with capacity building and trainings. Let me now thank actually Dr. Monica McDevitt, because I understand she has to go to another important meeting at UNEP. It was really an honor for us to have you with us. Thank you so much for sharing your insight, for your excellent presentation, and for also explaining to us all of the support you're giving in order to protect humans and the environment from hazardous chemicals. We look forward to future collaboration. Thank you for joining us today,
Alexandra. Thank you, and my apologies. I do need to go and chair another meeting right now. It's been a busy time, but thank you again for all the excellent work that the Future Policy Council, the World Futures, has been doing. It's been a fantastic opportunity to look at policies because it is so important in all of our work. So thank you again, and my apologies.
Thanks to you. So let us now move on to the last topic of our debate, and we want to actually now also look into if there are already some comments and questions. Please, the audience is invited to insert your questions also in the question and answer in the Zoom section. Let us now look into inspiring future regulations on chemicals of concern. First of all, moving again to Region Stockholm, our award winner. Do you think the success of the phase-out list from Region Stockholm could also be used as an example to inspire future and tougher chemical regulation at the national level in Sweden?
Well, I definitely think so. The list is already sharper or have higher expectations than the candidate list of the European Union. And I do really think that also working together with other regions in procurement, we can together working much harder on phasing out chemicals, which means that when doing that, we are pushing as well the market in front of us, as well as the government and what we are expecting from the government when it comes to legislation as well. So I'm quite sure of that. The answer is yes.
Great, fantastic. You will also be hosting this year Stockholm +50. So everyone will be having a look what's happening in Stockholm, and it will be excellent also to see how are you advancing on actually working towards a toxic-free future. Thank you. Let us now again ask actually our colleague Dr. Rodriguez from UNDP. We actually asked Dr. Kumvenda from the hub in Istanbul. Do you see in your work that banning hazardous chemicals in public procurement at the regional level influences regulation of chemicals of concern also at the national level or even at the global level, because you work regionally?
Yes, absolutely. We do see that examples starting from national level can influence regional and global levels. And I think, already said about the Swedish example, where for us, we used it in a global guidance to develop our own chemicals of concern list. And therefore, dwelling on that, now we have challenged all our project countries and the regional approach to each one of them to demonstrate which chemicals they will be eliminating and pushing the policies at national level and also at regional level. So we are quite confident that what started off 5 years ago in terms of identifying chemicals of concern, putting them in a document, a guidance document, which then is used in capacity development for procurement officials, has seen now this list going beyond Sweden, going beyond regions. We are in Asia Pacific, we are in Africa, we are in Latin America, here in Europe. The project is in Moldova and Ukraine. And we also take opportunity of the global forums that we hold every year to widely impact attendees with knowledge about chemicals of concern and other areas of sustainability in the health sector. We also have country-specific examples, Vietnam that has supported the inclusion of sustainable procurement for ensuring that migrates into national law in public procurement of Vietnam to eliminate plastics. So we see great examples. We have documented them in an impact storybook, which we'll be happy to share in the chat. And we know that national actors, regional actors, and ourselves at global level, we are influencing regulation and policies around chemicals of concern. Thank you.
Well, thank you so much. That is very impressive to hear the outreach and the work that you're doing from the hub in Istanbul with UNDP. And let me now turn again to Dr. Rodriguez from Honduras. I'd like to ask you, currently there's a specific project within the Ministry of the Environment in Honduras that works on strengthening the legal framework on this regard. Can you tell us a little bit more about what's happening in Honduras?
Okay, yes. Well, under the leadership of the Ministry of Environment and a large project to implement the Stockholm Convention in Honduras, a list of more than 100 substances for industrial use has been prioritized for regulatory purposes. Honduras is currently preparing to formulate 2 new regulations in this regard, specifically for the management of substances for industrial use and the management of hazardous waste. These regulations will lay the foundation for the establishment of a governance and technical mechanism to recommends goals for the gradual elimination or the phase down or phase out of the use of chemical products of sanitary and environmental concern in Honduras.
Thank you. Very exciting to hear about this. I hope it will develop very well in order to make a contribution to the protection of humans and the environment. That is very important. And let us ask again, Jenny Rovio from Finland. How's the situation in Finland? We heard also from Region Stockholm that they're planning to scale up their work also to the national level. How is it in Finland? Is your experience also that Finland has already its own national chemical program?
Yes, Finland has their own national program for hazardous chemicals, and we are actually updating that right now. In that program, the role of public procurement has been highlighted, and this implementation of program needs concrete tools, and that is for what we have been doing in Green Deal. So we prepare together with our cooperation municipalities and also with markets concrete procurement criteria list that can be included to the tenders. And the criteria list are prepared for different product groups. So this criteria development is ongoing process and based on experiences that municipalities have. We also support municipalities when they are preparing tenders. We give tips how they can use these criteria list, and additionally we also provide training for procurers about hazardous substances in generally. Thank you.
Thank you so much. So I'd like to actually thank now our esteemed panelists for the insightful thoughts and your expertise, and also let us now have a look what the questions are from the participants. There are a lot of questions coming in, so let me start with the first question. There's a question from Susan Wilburn to Dr. Kumbrenda. Please, how will the Sustainable Procurement Index Health be used by UN procurement offices to eliminate hazardous chemicals? Rosemary, could you please reply?
Thank you. Thanks, Susan, for the question. I was actually typing it in the chat. Thanks for the question. So we launched the index last year, and this year is the year that we are going to be rolling out the index to project countries, that is 10 plus the regional approach countries. Altogether, we have 14 countries. But at the same time, we have the global hubs of the United Nations, especially located in the Copenhagen hub of the United Nations. So we are going to be rolling out through training and capacity building of procurers, also from Healthcare Without Harm hospitals who have been part of the pilot and development of the index. And so in the rollout, we are bringing in new people that have not had the experience using the index, and they will go through the modules, which include a module on greenhouse gases, there's a module on chemicals, there's a module on human rights, gender and labor rights, and there's also a module on energy and water efficiencies. So we are quite excited about this rollout, which will make sure that procurers can understand the baseline of their producers of health commodities, where they intend to procure their commodities from, and come up with a plan of how their manufacturers or producers of those commodities will then improve their ratings. So it has a very nice visual that shows the manufacturer where they are, but it also helps the procurer to determine the areas where they want to put some mandatory guidance for procurement tender document. And so they can use the index at any level of their procurement process, starting from bidding process, but also through procurement and transportation, the index can be used. So we are quite excited to see the various entry points that our procurement officials are going to be using. Thank you.
Thank you. There's actually a follow-up question to you, Rosemarie Kwenda, and the question is, how has your project helped advance the awareness of chemicals around, how has the project helped advance the awareness around chemicals of concern in the health sector procurement? Is the question.
Yeah, so in terms of raising awareness, we have several forums. One of the biggest ones is the Global Manufacturers Forum. We make sure that every Global Manufacturers Forum has a session on chemicals of concern. So the first one we held in the Philippines, in Manila in 2018. Then we had a follow-up one in another region, Tanzania in Africa. Then we had a follow-up in Arab states. And last year we held one in Latin America, in Colombia, just to make sure that awareness is created around chemicals of concern and other sustainability dimensions. So we continue also with our own project-based capacity building, and we have two types of objectives in our project. One is capacity building for manufacturers of health commodities, and the other one is capacity development for procurers of health commodities. And obviously we have to measure the impact of both.
Thank you so much. There's also been a question from Andrea Zutinkan for Region Stockholm, but I understand this has already been, you have already answered it. It was about the kind of work you're doing on the phase out of PVC in the healthcare sector. So thanks. Maybe you want to add something, or is that sufficient for you what you have replied?
I think it's as much as I could provide at this moment.
Thank you so much for already typing up the question. That helps very much. Then there's a question also still. I have a question for Mr. Rodriguez. In Honduras, what are key aspects, which key aspects play an important role in regulating hazardous chemicals in Honduras, please?
Okay, well, I think technical capabilities as a first aspect, also a cost recovery approach to finance environmental and health surveillance actions for users of these chemical substances. Responsibility extended to the producer. Implementation in Honduras is a challenge as well. To transition to eco-labeling of safer products and articles, products with a lower concentration of hazardous substances, or their replacement by safer options. I think these are the basic challenges for for Honduras in regulating these substances.
Okay, thank you so much.
Mhm.
So thanks everyone again. And to conclude, I would like to ask now all of the panelists just to answer quickly the concluding question, and that is 2 short sentences, please. Which elements, which success factors are particularly key to effectively regulate hazardous chemicals in public procurement? Can we please start with Mrs. Jenny Rubio, please?
Yes, thank you. In my opinion, in addition to European chemical legislation, we really need voluntary actions. Municipalities can apply stricter chemical criteria in their tenders than it is obligated by legislation, and municipalities really should use that opportunity.
Thank you. Let's move on to Region Stockholm again.
Well, I am the only politician here, so of course I would have to say that having a strict political vision of phasing out all hazardous chemicals must be the next step, and that is in addition to what Jenny just said. Of course, you can have stricter rules, you can have stricter ambitions for yourself, but that starts with the political ambition.
Thank you. Ms. Rosemary Comwenda, please.
Yeah, I would say I would agree with our only politician. I would say leadership that is knowledgeable about chemicals of concern and toxicity, but also coupled with legislation and policies, and including policy implementation support through capacity building, training, and awareness. Thank you.
Very good. Thank you so much. Mr. Rodriguez, please.
Yes. From our point of view, the political willingness of the health and environmental authorities, adequate provision of technical and financial resources to ensure the success of the program for the phase out of hazardous chemicals in consumer goods that are being offered in the market.
Great, Dr. Rodriguez. And last but not least, Mrs. Nigarati, please.
Hi, and I think I agree with what all the panelists said. And additionally, I think it's so important to create the awareness of, the healthcare workers who are using the chemicals or the hazards that are linked to it. So currently there's no, the globally harmonized system for labeling of chemicals is lacking across. So I think that's something that could be uniformly applied across. So that's the additional point here. And thanks for having me all.
Well, thank you all your esteemed panelists for your recommendations about the next steps that are required. And ladies and gentlemen, we all know that the pandemic, the COVID-19 pandemic, is actually really a stark reminder that human and planetary health are really closely linked, and we need to apply the precautionary approach to human health and the regulation of hazardous chemicals. And we need to really switch to safer alternatives to protect the health of the population, specifically of children and of the environment, to really ensure a common future on our planet. So today we learned a lot about the significant potential inherent to sustainable public procurement, how important it is, which role it can play, that we can harness it really in order to shape a toxic-free future. The discussed Swedish policy at the webinar is one of the 60 policies from 40 countries that we have awarded from the World Future Council with the Future Policy Award. And we invite you to visit our website, futurepolicy.org, to learn more about the award-winning policies that are really driving positive change. Join us in spreading the good news also about the success stories that we learned about today in the webinar. Engage with us for a better, healthier, and regenerative future. And we're really pleased to contribute with this webinar to the World Health Day 2022. I would like to thank again our esteemed panelists with a huge gratitude for accepting to share your time and your knowledge with us. We're really grateful. And also to all of your cherished participants and listeners who joined us on Zoom, who joined on Facebook. We thank you for your time, for listening, and for your questions. And we really hope that you all will become ambassadors for a toxic-free future in all of your communities around the world and help to push for healthy and sustainable societies. And finally, I'd like to thank the team that is behind the scenes that worked hard to make this webinar possible, specifically Ingrid Fritsche, Anna-Lara Steen, Damian Kramer, Samia Kassid. Thanks all for your efforts and your hard work. And also we want to invite you to follow World Future Council. You can follow us on social media, Facebook, Twitter, Instagram, or LinkedIn. And you're also invited to follow and subscribe to our newsletter, so you will not miss out future webinars and other activities. Thank you once more for joining us, and see you another time. Enjoy the rest of your day. Goodbye.